Hi guys, how are you? If you have any doubts or if you have any queries, you can just start messaging us. So we can start the webinar. Sorry that I couldn't start at 7 o'clock because of some technical errors, but we are starting right now. Hi, okay. So let's go into today's webinar. So three things I want to discuss before getting into the webinar. First question, can you just please message that are you already preparing for FMGE, or you completed your course, are you graduates, or are you still in the final year or internship? Can you message any ideas? Because when we are going to talk, the aspects or the perspectives of talking will be a little different if you are from different batches. Okay, graduate, okay, fine. What about others? Okay, internship, okay, intern, second year, intern. Okay, that's okay. Fine, fine. Okay. Just wanted to assess because we have variety of audience now. There are students from second year, there are students from final year, there are students from internship, and there are graduates too. So I have to convey the information slow manner, and also with if second year students are there, then we won't be able to give only the advanced concepts. So let me explain one thing. I'm going to tell you some hacks or tips how to approach the MCQs. So one by one, I'll go into details. So that's the topic today. Yeah, guys, if you are running the mic, then can you please mute yourselves? Can you please mute yourselves? If you have any queries, you can just send me a message, no problem. Okay. Let me, fine. So we can start now. So I'm Dr. Harry. Can you guys mute yourself so you won't be disturbing others? It'll be difficult for me to explain also, and others might be getting the disturbance, so they might not be able to hear. So if you don't know how to mute, yeah, in one corner of, so I can show you here. You can see here, in one corner you get mic. You can just click it, it'll be muted. If you want, you can also shut down your videos if you need, because someone's video is on still. Okay, I'll start now. Okay, my name is Harry. So I just wanted to start with a very small story. I started in China in 2000. Then I have been teaching in China since that time, officially in a government university. And guys, can you mute? Guys, can you mute, please? Yeah, I'm trying now. Like I'm trying to mute them. Yes. Okay, we can start now. So I want to start with a very small story. So as I already told you, I started working in China in 2012. And since 2013, I have been appointed there officially in a government university. So there were a lot of Indian students there. When I went there, even though we had really very good students with sound knowledge, but once they start giving the MCQs, the objective type of exams, even the best students started flunking. So when we started working with these students, we understood that you should know there are two things. You might have sound knowledge in medicine, but if you don't know how to implement this knowledge in MCQ and approach the MCQ in the correct way to choose the best answer, you won't be able to pass this exam. So this is a paradox. Some students I have seen that really they are like very good. They study really hard. Once we ask any questions in Viva, they are able to answer anything. But once they are sitting for the objective type of questions like MCQ, they flunk. So we noticed that there's some issue. So this is about the technicality. This is about the approach. You should understand only knowing is not enough. You should be able to apply. If you won't be able to apply your knowledge, whatever you studied within the time frame given, you will not be able to pass this FMGE. So you know that the average pass percentage of FMGE is lesser than 25%. So about 75% of the students are flunking. And if you see, the real reason for flunking doesn't need to be that they are dumb. Doesn't need to be that they don't know anything. They might know, they might have the knowledge, but they don't know how to implement this knowledge into MCQs. So how to approach the MCQs, how to manage the software, how to manage the time during the MCQs. If you don't know these skills, if you don't acquire these skills, you won't be able to pass. When I realized this in 2013, I started implementing a special program of analyzing students with Analytica. After that, teaching them exactly how to approach the MCQs. And now JZMU students have one of the highest pass percentages. Many of my students scored even like 200 plus, 230 plus. It's not rocket science. Really, we are teaching them about their strengths and weaknesses. We are teaching them the skills what they have to acquire. Okay, I'm going to the next slide. If you have any doubts, guys, yes, you can just yes. If you have any doubts, you can message me. If you have any queries, you can message me. Okay, let me go into next slide. These are some of the books or titles I published. I'm not going into much details, you know this. So I also published with Jaypee and Elsevier. At least I used to publish with Elsevier and Jaypee. Now we actually stopped publishing and we are exclusively publishing with Davinci publishers. And you know about this book. This is QRS, which is the hot cake right now. And there were more than 160 questions appeared from QRS book in past December FMG 2019. Okay, these are some of my students. DMA created more than 2,000 toppers since 2010, and many of them scored more than like 200. And especially I want to show one of my students, and he was my student in first year in China, and he scored 237 marks, and he was the second highest topper in India. So you should understand exactly, learning is important, comprehension is important, knowing what you are studying and how to apply this knowledge into MCQ is much more important, because knowing the text, knowing the theory is not enough. You should be able to apply and you should be able to approach the MCQ correctly. This is the concept of today. Let's go into detail. So the specific test taking skills, what I'm going to discuss today, will enhance your accuracy efficiency, and it is going to help you in the decision making. So once you increase your confidence, accuracy, and decrease the anxiety, you know that you will be able to choose the appropriate answer. Because I'm going to explain you what is the neuroscience behind approaching an MCQ or doing an MCQ or approaching a question. So if you know exactly what is happening in your brain, and if you learn that how can you reinforce whatever is happening in your brain or enhance the efficiency of what is happening in your brain, then you will be able to crack this FMGE very easily. So keep it in mind, guys. I want you to participate in this webinar. It is not going to be static. Yes, you are going to participate. I'm going to ask some questions and you will be able to answer. Keep it in mind. The best way of learning, the most efficient way of learning is active learning. Active learning can be realized through discussion. It can be realized through question answer session or doing the mock test. Yes, it can be realized through, once again, what else? Discussion. It can be realized through question answer session or doing the mock test. So here we are going to do some kind of question answer session. And once you are asked any question, you can try to answer. Don't worry, you are making a mistake. Keep it once again in your mind. My professor used to say that the best way of learning and the best way of retention of whatever you studied is learning by your mistake. You learn by your mistake, you are going to remember it for quite a long time. So once again, once I'm asking a question, it's not going to be about the technical part, but also it can be about some subject. You try to answer something, engage yourself. You are going to involve in the webinar. So we are going to reinforce the active learning over here. Please try to write something whenever we ask. Don't mind about the mistake. You learn best by the mistakes. So here I'm going to tell you some kind of techniques. I'm going to give you the insights. I'm going to give you the solution, how you are going to approach the MCQs. That is going to increase your accuracy. That is going to increase your efficiency. That is going to increase your confidence level and decrease your anxiety, which means that you can choose the best answer. Guys, please mute. Okay, let me go to the next one. So this is the neuroscience of approaching an MCQ or question. So let me say that now you are going to read an MCQ. Once you are reading the MCQ, it is going to be projected in the visual cortex. You know that once you are seeing something, the projection from visual cortex is going to go to a center. We call it as visual comprehension center. How do you call? Visual comprehension center. So here, whatever you read will be comprehended. You understand what did you read. From this comprehension center, message is going to be passed to your center of cognition. What is the center of cognition? This is the prefrontal cortex. So it is going to think, it is going to solve the problem, and it is going to reason which answer to be chosen. And this is going to project to another one area in the frontal cortex. We call it writing area or Xness area. And after the projection from here to the Xness area, you are going to choose an answer. If it is going to be a paper, you will be writing something. Or if it is a computer, you're going to choose the answer. This is technically the neuroscience of approaching a question which is written. Your question is in written form. So you watch, you read. So whatever is projected to this visual cortex will be projected through the visual comprehension center. Now you understand exactly what they are asking. That will be projected to your prefrontal cortex. So there's going to be analysis. There's going to be a problem-solving approach. And this brain is going to reason which answer to be chosen. So once the brain decides the answer is D, it is going to send a message to your Xness area, or we call it writing area. So from there, now your hand is going to move and choose answer D. This is how your brain works. So if your brain has to work completely, you can understand, first of all, you should be able to read clearly, and your brain should not be disturbed. You should have clear mind in order to understand the language what is written, because the medium of exam is English. So comprehension is very important. From there, your brain should be clear enough to run the analytics, to run the problem solving approach and the reasoning to come to a conclusion. You know that what is the term which we can use for cognition? The one word we can give for cognition is decision making. So this is making a decision, and after that message is going to pass. Message is going to pass to another one part of frontal cortex. This is called writing area, exness area. From there now activation of your, yes, lower motor neurons, yes, and you're going to choose answer A or B or C. One important thing, keep it in mind. Once you're working in a task, you always have some little anxiety. This is called performance anxiety. Once you have performance anxiety, your brain will be vigilant. It is working well. Yes, which means you are thinking well, you are trying to take the action, you are trying to reason, everything is working well. Once your anxiety is disproportionate, too much of anxiety, it is going to shut down your brain. It is going to shut down your cognition. So keep it in mind, once your brain is going to work clearly, there should be no disturbance. There should be no much anxiety. Little anxiety is okay. Too much of anxiety, it will shut down your brain. So this is the neuroscience of approaching the MCQ. It's very simple. So from this point of view, you can understand there are 5 factors that determine the successful approach to MCQ. So first thing is comprehension of MCQ. So once you are reading, you should be able to understand what is written. Second thing, analysis of question. After analyzing of question, your brain should be able to recall some facts, because if you don't remember whatever you studied, you won't be able to answer. So the third factor is recalling the necessary information. After recalling, your brain is going to reason that answer A is wrong, answer B is wrong, answer C is wrong, answer D is correct. This is very important. This is reasoning. The last very important part is time management. You should be able to come to a decision to choose one option within a time span given. This is going to be 40 to 50 seconds only. So comprehension, analysis, recall, reasoning, all should be done within the time limit. If you don't know how to manage the time, you fail. If you don't understand the question, you fail. If you don't know how to analyze the question, you fail. If you don't know how to recall whatever you studied in your class, you fail. If you don't know how to reason which answer is correct, which answer is wrong, you fail. If you can do everything, and if you give 10 minutes for one question, you won't be able to answer all the question and pass. Again, you fail. So that's why there are 5 factors. Let's go. What is going to be the plan for today? I'm going to explain you structure of MCQ. This is a very funny thing. When I teach pathology, all the students would be reading the textbooks. When they read the textbook, for example, if you think about the first chapter, cell injury, they will explain about the mechanism of cell injury, etiology of cell injury, morphogenesis of cell injury, and they will explain about also the histopathology of cell injury. But if you ask on contrary, what is cell injury, nobody answers. Same story over here. Everyone is trying to approach the MCQs, but nobody is thinking that what is the structure of MCQ. If you know exactly what is the structure of MCQ, how to see the pattern of MCQ, how to analyze the MCQ, how you are going to approach the MCQ, how to reason and choose the appropriate option, there will be no problem at all. I'm not blaming others, but keep it in mind, nobody is in market explaining about how to approach the MCQ. Everyone will be telling that do MCQs. Everyone is saying that, you know, like do the mock test, read. Nobody explains how to read. Everyone says that you should have a perfect time management. Nobody explains how to have the time management. So today we have the 3rd webinar. Once again, I want to emphasize to you guys, we had 2 webinars. In the previous webinars, we explained about how to make a smart study plan in 60 days, how to read, how to revise, how to do the test, what are the key factors that is determining people to pass the FMGE, what are the key reasons of mass failure of FMGE, what are the solutions for this. I did 2 webinars. They are very essential if you want to pass the FMGE. We uploaded both of them in YouTube. You can find them. I advise you, please go and find them. It is free of cost. We are teaching our students how to learn. First of all, you should learn how to learn. You should learn how to approach your exam. If you don't know this part, whatever knowledge you are having, you are not going to pass this exam. It's very simple. You have the knowledge, you don't know how to imply this knowledge into MCQ, how to choose the answer. Even having that much of knowledge, it is not going to help. So here, in today's third webinar, I'm going to explain about all these things: structure, pattern, distribution, analysis of MCQ, special tricks and hacks to approach various types, art of choosing the most appropriate option. We are not going to talk about time management. We're not going to talk about intelligent guess. We are not going to talk also about how to change the options, because dedicating all these topics for the next webinar. So today we are going to discuss only these 5 things. So guys, please mute. So can you see this image? Now you can understand this is a metaphor. So I'm comparing your knowledge, the medical knowledge, to this gun. You might have this gun, but you should know how to use this gun properly. If you don't know the tactics, if you don't know how to approach this gun properly and how to shoot, you will fail. You can just compare this image with yourself. You have sound knowledge. You studied for 6 years and 5 years. You studied all textbook. You went to one or the other institutes. You used one or the other app. You have sound knowledge. But if you don't know how to use this knowledge, if you don't know how to implement this knowledge into MCQ, how to approach the MCQ and reason and get the appropriate answer, you will flunk. So you can see over here, holding this gun in a wrong way, he's not going to shoot the target. The same story. You have knowledge, you don't know how to implement, you won't be able to crack this exam. So this is my duty, that I am teaching my students how to approach the MCQs. I also want to make it public. I want to give the same knowledge to all the students who are trying for FMGE or any other exam. I want to teach them how to approach the MCQs. So let's go into the detail. So be ready for the active participation. Try to answer when I ask some question. You can type, you can message. This is the best way of learning. The active learning depends on discussion and doing the tests. And second thing, if you make a mistake and try to understand the concept, that is the best way of retention. So let me go into the concept. So first thing, let's explain what is MCQ. So multiple choice question means this is an objective question which will be having 2 parts. What are these 2 parts you can see over here? It is going to have a stem or body. And it will be having alternatives, choice or response or options. In FMGE, you will be having 4 response. In some other exams, if you remember, they might have 5 response. Here, you have 4 response organized in alphabetical order, A, B, C, D. So some students call these responses or choices or alternatives as answers by mistake. So the choices are mistakenly called as answers. They are not answers. They are alternative, choices, response, or options. You are going to choose one of the best out of all these 4. So once again, you have a stem or body, you will be having alternative. What will be the part of the body or stem? You will have 2 essential parts. You will have some statements, or you will have 1 statement, and there will be a direction. So these 2 parts will be essential. What about others? You might have some images, you might have some data, you might be having some qualifying word. I'll explain what they are. So there are essential components of the body and non-essential components of the body. What are the essential components? There will be a statement, or there might be more statements, more than 1. But there will be a direction. Direction is the part of stem which is directing you toward the problem to choose the answer. So this is the most important part. If it is image-based question, you might have an image. If it is a question connected to compare and contrast, lab data might be there. Or if they are thinking about giving a negative stem, then you might be having some kind of qualifying word, which is except. So stem contains statements and direction. This is going to be the constant type of part, and this is non or inconstant one. And you will be having alternative. Let me show you. If you think about this question, you are having a case-based question. So this part is called as stem. Is it clear? This is called as stem. I'll show you. This is stem. So stem will be having two essential parts. What are these essential parts? The first part is called statement. Can you see? This is the statement. And what is the direction? This is the direction. You can see this green one is the direction. Because this is the part which is, this is directing you to know the problem, and this is directing you to understand the question and choose the options. So the part of stem which is directing you towards the problem is called direction. Remaining part is statement. In this, there are more than one statement. You see, there's one sentence, second sentence, and third sentence. So multiple statements and one direction. And what are these parts you can see over here? What is this? These are called the alternatives. So once again, we have a stem. There will be two constant parts, and there will be four alternatives in FMGE. Okay, let's go to more in detail. So what is direction? This is a part of the stem identifies the question or problem to be answered. I already told you. What are the qualifying words? Qualifying words will help you to narrow down the choices. So once again, qualifying words might be there or might not be there. For example, they can give you except. This is a qualifying word. Most common, qualifying word. Least common, qualifying word. There will be an age group. Like for example, they can ask a question. What is the most common cause of bacterial meningitis in neonate? Which means this is a specific age group. Neonate is qualifying word. If it is adult, qualifying word. You will not find this in all, but you might find in some questions. So let me show you here. So again, you can see this part is called stem. Stem is having this yellow color. Yellow color is direction. And what is this except? Except is called qualifying word. And what are these four things? These four things are alternatives. Out of this A, B, C, D, one will be the appropriate option, which means one is the correct one. All others are wrong. So if you look into this question, can you try to answer this question, guys? Let's see. So all of the following pairs of adult derivatives of embryonic structure is correct, except. What is the correct answer? Let's see. Don't worry. You can mark. Let's see. So there are multiple answers. A, B, D, only C didn't come. Mark, let's see. I will explain you, don't worry. You are here, I'm here to explain you. Nothing to worry. So this is called a negative stem question. I will explain you. So they are asking about the adult derivative of embryonic structures. One by one, I will explain you. You can see in the heart, foramen ovale will be turned into fossa ovalis because it will be closed. There will be no connection. There will be no anatomic connection between both the atria after you are born. So the foramen ovale, which is open in the time of fetus, will be closed. It will become fossa ovalis. And if you remember about ductus venosus and ductus arteriosus, both of them will be changed or turned into ligament. Venosus will become ligamentum venosum and ductus arteriosus will become ligamentum arteriosum. If you remember about the umbilical vein, Umbilical vein brings the oxygenated blood from placenta and it is connecting to the portal vein and also to the inferior vena cava. Yes, once you are born, this is going to be turned into the round ligament of liver, or in Latin we call it ligamentum teres hepatis. So all of them are correct. So now you can see all the following pairs for the adult derivatives of embryonic structure is correct, except, so one is wrong. What is wrong? A is wrong. Umbilical artery will be sclerosed and it will become medial umbilical ligament in adult. Medial, not median. Median umbilical ligament will be urachus. So urachus is the connection from bladder that is going to turn into median, which means middle umbilical ligament. Umbilical artery will be turning into medial umbilical ligament. So the wrong answer is technically the A one. But here, because of except, the wrong one becomes the right. I'm going to explain you how to approach this except question. Right now, you practice. Nothing to worry. I already told you, if you made mistakes, no problem. No problem at all. You learn best by making mistakes. So don't worry. There's a saying by Einstein. Knowledge is equivalent to 1 divided by your ego. So knowledge is inversely proportional to your ego. If you have too much of ego, if you don't want to answer, if you don't want to learn by your mistake, then keep it in mind, it will be difficult for you to retain whatever you study. Make mistakes and learn. Everyone is making mistakes and learning. This is how we learn. Trial and error. Trial and error is the best way of learning by nature. Okay, let me go to the next one. Okay, there are two types of stems. I'll explain about two types of stems. What are the two types? First is positive stem. Positive stem means they are going to have some kind of either full or partial statement, direct question, or single word which is asking a question direct to you. So they are not twisting the question. They are not giving the inverse or the negative version of the question here, which means the stem is technically called as a positive stem. How do you call? Positive stem. Example I'm showing you over here. You can see. What is the example? The most sensitive cells to hypoxia. So they are giving the answers: myocardial cells, neuron, hepatocytes, and renal tubular epithelial cells. Can anyone answer? Cells most sensitive to hypoxia. What are these cells? Let's see the answer. Most sensitive cells. Okay, more. Yes, yes, yes. You can write, no problem. So you can see here, what is the qualifying word over here? The qualifying word is most sensitive. Yes, the qualifying word will be most sensitive. So all these cells are sensitive to hypoxia. Keep it in mind. All of them are sensitive to hypoxia. Yes, think about myocardial cells, they are sensitive. Neurons, they are sensitive. Hepatocytes, they are sensitive. Renal tubular epithelial, all of them are sensitive. But the question, what is the qualifying word? Most sensitive. Most sensitive will be neurons. Most sensitive will be neuron. Yes, neurons cannot withstand the hypoxia for more than 4 or 5 minutes. On average, usually it is between 3 to 5 minutes, some books 2 to 4 minutes. Yes, usually, yes, if you think about myocardium, it is 20 to 30 minutes. It is 20 to 30 minutes. And resistance of hepatocytes and renal tubular epithelial cells are longer. But think about the highest resistance, there will be fibroblasts. Of course, if you think about skeletal muscles, they can be in hours, they can go to 4 or 5 hours, up to 6 hours possible. If you remember, once we are bleeding, we are putting the tonic weight, we are compressing the skeletal muscles. Sometimes we are compressing it for hours until we reach the hospital. But the skeletal muscle below this point doesn't get necrosis. Why? Because the resistance for hypoxia is quite higher. It can be up to 4 or 5, even some books it is 6 hours. But the least resistant cells will be neurons. Keep it in mind, neurons don't have a reserve for anaerobic glycolysis. They cannot survive in anaerobic glycolysis. They need only aerobic mechanism of respiration. So once there's no oxygen, the neuron will start to shut down within minutes, maximum 5 minutes. So the question is, cells most sensitive to hypoxia. They didn't ask just sensitive, because all of them are sensitive to hypoxia. Now this is the relative degree. What is the catch point? What is going to be the qualifying word? Most sensitive. So answer should be neuron. So answer is B. Okay, let's think about the other question. What is the other question? Now let's think. Negative stem MCQ. In negative stem MCQ, they are going to give the stem in the inverse manner. They are going to tell a statement, and by the end of the statement, they are going to give a qualifying word like except, least likely, will not exhibit. So keep it in mind, once you are reading the question, you should read completely, because many people, more than 30% of the students, tend to overlook the qualifying word except. They make mistake because they don't read the except. So I'm going to show you exactly how to come to the answer, how to choose the best option. But right now, if you can choose. But I'm going to show you exactly what is the trick, what is the hack to approach the negative stem MCQs. But anyhow, whoever is writing, please write the answer. Let's see. So the poll starts now. Fibrinoid necrosis may be observed in all of the following except. Your answer is? Answer is? Involve more, active learning, make mistakes, learn by mistakes, you learn best. In Tamil there is a saying, Soodu kanda poonai aduppai naadade. Once the cat is going near to the fire, once it gets burned, it never goes back towards the hearth. In English they say this, yes? So once the cat is going to be hurt, once it burns its tail, it will never go back to this hearth, because it knows it made a mistake and it burnt its tail. Same story. You make mistake, you learn by this mistake, you will never forget this. So here the answer is going to be C. I will explain why it is C, not right now, little later. So the answer, of course, it is correct. It is C. Many people made the correct answer, and all those people who are like little mistaken or who got confused, I'll explain why it is C. Not right now. I'm going to explain how to approach this negative step. Okay? Let's go to the next one. So alternatives. So there is a misperception by most of the students. Yes, they call it as answers. They are not answers. We have 4 alternatives, choices, options, or response. Keep it in mind, I'm explaining about MCQs in FMGE only. MCQs in FMGE only. So we have 4 choices arranged in alphabetical order. A, B, C, D. Keep it in mind, only one will be appropriate or the best choice. So sometimes it doesn't need to be the correct answer, but pertinent to this question, this answer A or the option A is the best choice. It doesn't need to be exactly correct. So pertinent to the question, you have 4 options. Out of 4, 1 is the correct one or the best choice, which means what are the 3? They are the distractors. Keep it in mind, examiners love to use these distractors, especially in the first and second position. Now you can understand when you are answering the question, many students actually answered myocardial cells. Why? Because I know the examiners actually tried to put some answers to divert you. These answers will allure you to choose them, but they are distractors. They are not correct. If you see, many people actually chose myocardial cells. They are not correct. So keep it in mind, examiners love to trick you. Examiners love to trick you, which means they love to make you get confused. So usually in the first and second position, they try to put some wrong answer, which will be looking like correct answer, and altogether 3 incorrect answers are called as distractors. You always read guys, mute. You should always read 4 options before choosing the answer. If you don't read all 4 options, you tend to make the mistake. Keep it in mind. Okay, the last part, once again, most of the examiners try to put a fancy sounding false answer. It will be similar but false. Again, they will try to put this into first or second position. I'll give you an example. Once again, you have MCQ, which is an objective one. You are going to have a stem or body. You will have alternative. What are the peculiarities of alternatives? I already explained it. 4 choices. One is the appropriate. There are no multiple answers. There are no multiple correct options. Only one. So if one is correct, other 3 are distracting you not to choose the best option. So they are called distractors. Usually the examiners put them in first or second position to trick you. They also try to use fancy sounding false answers, especially in the first or second position, to trick you. I'll show you one. So now you try to answer this question, but anyways, I gave you the answer. Disease caused by Coxsackievirus in human. Coxsackievirus can cause anything in your body. Yes, it can cause herpangina. It can cause meningitis, but keep it in mind, this is aseptic meningitis. It can cause conjunctivitis. It can cause myocarditis. It can cause pericarditis. It can cause pleuritis. It can cause another one disease in children. We call this disease as hand, foot, mouth disease. This is a mild contagious infection. Usually seen in children, they get blisters in hand, foot, and mouth. How do we call it? Hand, foot, and mouth disease. But keep it in mind, there's another one very similar disease of animals. This is called foot and mouth disease. Foot and mouth disease is similar, but they are not in human. This is usually found in cattle. Of course, you can find in also cat and dogs. But this is not the Coxsackie viral infection caused in human. So this is actually sounding similar to hand, foot, and mouth disease. That's why usually your examiners love to give some distracting type of fancy sounding false answers, especially in the first or second position. You see, as soon as you see foot and mouth, you are going to mark this. Why? Because in pediatrics you heard a disease. What is this disease? Hand, foot, and mouth disease. It is sounding similar. But this is not correct. So keep it in mind. There are 4 options. 1 is correct. So 3 are distractors. Keep this hack in your mind. The examiners love to trick you by giving false answers in 1 or 2 position, especially by giving fancy sounding false answers. Is it clear? Let me go to the next one. So this is very important because we have to know the pattern of MCQ and distribution of MCQ, how it was before 2012, how it changed right now. If you don't know the pattern, then you won't be able to approach. You make mistakes. You analyze your opponent. You analyze your challenger. Who's your challenger? FMGE. So let's go into the details. So we have 3 types of MCQs. First type is called as simple or recall type or fact-based type. So how many percentage is this type of question in FMGE? We have about 60%, but before 2012, 90+% of the questions were simple questions. So it was easy to pass. If you could recall, you have good memory, you pass. So how do you answer these questions? It will be purely based on the simple recall of the fact. If you foster some kind of mechanisms and tricks how to recall, for example, like mnemonics, you pass. It was quite easy to pass before 2012 than passing right now. Why? Because if you want to be a confident and profound doctor, you should have a knowledge that should be problem solving and conceptual. So you should be able to implement your knowledge to problem solving approach. There are three types of question here. There can be statement based. Yes, sorry. There can be statement based. I'll show you here. There can be compare and contrast. There can be case based, or they can be mixed together. So keep it in mind, before 2012, there were lesser than 10% of the question from this problem solving or conceptual. But after 2012, now it became 30%. The last part is called image-based question. So there can be gross images, there can be photomicrograph, there can be radiograph, there can be graphs or processes. They can ask direct question or indirect question. Keep it in mind, before 2012, such type of questions were negligible, and after 2012, it became about 10%. Now you can understand, simple recall became 60%. It can be 70, but usually it is 60%. Problem solving and conceptual 30%. Image-based question 10%. Totally 100%. There are some pilot questions we don't know, because the National Board of Examination will be using some question for probing to check the level of research orientation, to check the level of updates, whether they can use such kind of MCQs in the future. They use some kind of probing MCQs or checking MCQs. Exactly, we don't know how many percentage are from these pilot questions. But if you go to USMLE or Australian Medical Council exam, they will tell you how many will be pilot question, what are the pilot questions. But in India, they don't tell you, so I'm just ignoring it. Simple, problem solving, image based, 60, 30, and 10. So now you can understand how you should start working in order to approach the MCQs. You should be able to approach simple recall, you should be able to approach problem solving, you should be able to approach image based. Let me go. Example one by one. So simple recall question. So what is this? The fixative, the most common fixative used in histopathology. They are asking about light microscopy. What is the answer? The most common fixative used in light microscopy histopathology. What is it? Answer? Answer? Light microscopy, I'm asking. Light microscopy. You will study in detail in pathology. Keep it in mind. The most commonly used fixative in preparing the specimens for light microscopy will be 10% buffer neutral formalin. So formalin is the most commonly used fixative. So now you can see it is very simple and fact-based. If you know the fact, you will get the answer. You studied this, you are storing in your brain, you should use some kind of mechanism to bring it back, some kind of mnemonics. If you can bring it back, you get it correct. If you don't bring it back, you won't be able to mark this. Keep it in mind. This is called simple recall or fact-based question. And how many percentage of the questions are coming from this? About 60% will be from this. Keep it in mind. 60%. So more than 150 questions are simple recall. So you should know how to approach, how to remember, how to recall. You will pass. It's very simple. So we are providing our QRS book. We are categorizing the facts in a way that you recall so fast. That's why 160 questions appeared in the last FMGE. And most of the students who used our book, they were able to crack because we already showed them How to study, how to remember, how to recall. It is very simple. Okay, let's go to conceptual question. So conceptual question, first type statement based or task based question. Second type compare and contrast. Third type is going to be case based question. So here you can see true about some of my bodies are all. This is a negative stem question. Why? They are putting this except. So what is the answer you think? What is the answer? So keep it in mind, we have a qualifying word except, which means this is a negative stem. So let's see the answers. What students are giving, nothing to worry. So answer is, most of the people chose D. 1C. Read again. Read again. True about some of my body, and the last part is except, which means indirectly you should understand what is wrong about some of my body. So what is some of my body? What is some of my body? Let's see. What is some of my body? What type of calcification? Write down your answer. What type of calcification is some of my body? Dystrophic calcification. Yes, this is correct. So this is a special form of dystrophic calcification where you will be getting accumulation of calcium in lamellated concentric walls. They are small, spherical, concentric, lamellated walls of dystrophic calcification. So what is correct here? What is the composition of some of my body? This is calcium. So this is correct one. Yes. And this is concentric lamellated walls. Is it correct? Because they look like small grains of sand. In Greek, samo means sand. That's why they kept this name. Samo my body means sand-like bodies. They can be seen in microscopy only. They look like small grains of sand. That's why samo my body. So they are calcium deposits. They are concentric, lamellated, walled, small grains of sand appearance. Where you can find this? What tumors you find this one? How to remember what is the mnemonic? What is the mnemonics? M-O-S-T. How to remember? M. Meningioma. Yes, M is meningioma. M is mesothelioma. And other three are papillary cancers. What is O? Papillary cancer of ovary, papillary cancer of salivary gland, papillary cancer of thyroid. There are other cancers too, but for FMG, remember, how to remember where do you find soma body? You find in tumors, and you can say not only benign tumors, you can find malignant tumors. So better to put just tumors, not to specify malignant or benign. So M is meningioma, mesothelioma. O, papillary cancer of ovary. S, papillary cancer of salivary gland. T, papillary cancer of thyroid. So what is correct now? A is correct. B is correct. C is correct. So what is wrong? Teratoma is wrong. So answer D is wrong. But the question is negative stem. So the correct answer should be D. Did you understand? If you understand, you can write yes. If you didn't understand, you can ask me. Yeah, okay, good. I will show you how to approach the negative stem question later on. But just I wanted to give you some knowledge. That's why I'm just showing you how to approach. You see how it is easy to remember what cancers. Again, recall depends on revision and some special techniques like mnemonics and some other techniques I'll tell you. So it's very easy. Most, M-O-S-T. You understood. You have the answer. Okay, let me go to the next one. Next question is compare and contrast question. This is a conceptual question. Let me explain this. If it is difficult for you if you are from second year, then forget about this, but I'll just show you. So what is this question? You can understand over here. 50 years old lady presented with history of pain in upper abdomen. So if you see the answers, all options are possible. This patient can have pancreatitis, patient can have alcoholic hepatitis, patient can have viral hepatitis, patient can have peptic ulcer which penetrated. So let's read the case. Bilirubin is 10, which means what? Which means she is jaundiced. Because in physiology you should understand normal level of bilirubin should be lesser than 1 milligram per deciliter. More than 2.5 gram per deciliter is called clinical jaundice. This is 10, which means jaundice, obviously, which means liver is affected. Next thing, ALT. Yes, ALT is 1500 units per liter. AST is 700 units per liter. Yes, 700 units per liter. Now you should understand, you should be able to exclude two options first. There is no story of amylase or lipase. If there is no story of amylase or lipase, you can exclude pancreatitis. You can also exclude posterior penetration. If there is involvement of peritoneum, there will be amylase. You exclude this. No story about amylase. Pancreatitis, amylase, and they didn't ask anything. So you have to reason between these two. In case of hepatitis, yes, the enzymes of liver will increase. ALT also will increase, AST also will increase. What is the catch point? If it is alcoholic hepatitis, usually the increase of ALT or AST will be below 300 units. Is it below 300? No, it's above 300. It is 700 and 1500. Another one thing, very important thing. If ALT is at least 2 times higher than AST, it is viral hepatitis. Why? Because ALT is more specific for liver. If AST is much more than ALT and the total amount of the enzymes will be lesser than 300, then alcoholic hepatitis. So obviously, what will be the most likely diagnosis? Viral hepatitis. This is the answer. Viral hepatitis. There is no homeostasis. Why? Because alkaline phosphatase is 280. Usually in case of homeostasis, alkaline phosphatase will be more than 360. So the higher limit of ALP is 120. It should be more than 3 times to put a diagnosis of homeostasis. So it's very simple. But what type of question it is? Compare and contrast. So you are comparing the lab data and you are contrasting between 2 or 3 diseases. This is called a conceptual type of question. So what is the answer again? Let's see whoever marked here. Whoever marked here. So, okay, the answer is viral hepatitis. Yes. Okay, let's go to the case-based question. The case-based question. So, case-based question. So it's a big question exactly right now because I'm going to show you how you're going to approach this. So there's going to be a case. They're going to give certain sentences, and at last you are going to find. Guys, can you please? Can you please mute? Okay. So they are giving a direction here, and they're going to ask a question either direct or indirect. So this is a case-based question. Sometimes these conceptual questions might be mixed. They can ask a statement after giving a case. They can ask you to compare and contrast data within the case, so it can be mixed. So right.
Screen is not visible.
Guys, can you please mute?
Screen is not available, sir.
Oh, screen is not available. Just hold on 1 minute.
Okay, sir.
Is it okay now?
Sir, fine, sir. Fine, sir.
Okay, fine. So this is the case-based question. So this is the last type of question what you find in case of conceptual. You can see they give a small case or big case. They will be giving number of statements. At last, they will be giving you a direction to choose an answer. This might be mixed sometimes. They can ask a statement. They can ask you to compare and contrast. It doesn't matter. So all of them are conceptual questions. Let's go to the next type, image-based question. They can ask image-based question direct or indirect. I can go fast. So what is the answer? Identify the part of duodenum marked by arrow. So they always give you an arrow and they will ask you to find out what is marked by the arrow. So you should be able to do the data analysis and find out exactly what they are asking. So let's see the answers. So most of the students, yeah, you are correct. Good, good. So we already know duodenum is the initial part of small intestine. It has 4 parts, yes? So it will be having first part, it will be having another second part, third part, and fourth part. Yes? This is first ascending. Yes, this is the last ascending part. Second will be descending and transverse part. So the arrow is marking the transverse part. Yes? So third part, which means answer is B. So here you can understand, they give you a question, they give you an image, they put an arrow, they are going to ask you to analyze and come to a conclusion. Direct question, what is this? That's it, like a spotter. Let's go to next one. Next question is indirect question, which means they give you an image, giving you a spotter, and they are asking an indirect question. First of all, you should understand what is this muscle. After that, you can understand, identify the nerve which is supplying this marked structure. So I am not going to explain this right now because I'm going to teach you how to check the image-based question effectively. What is data analysis? How do you analyze? So let's see what are the answers. So most of the students are writing answer D. It's okay, you can write. Let's see. You can write the answer. Answer is okay, December 2019 MCI question. Good. Answer is D. Yes, you are right. You are correct. Right now, I am not going to explain in detail how to find this answer and how to check this image because I'm going to go into detail. I'm going to teach you how to analyze the stem, how to analyze each type of MCQs in detail, how to come to a conclusion, how to reason, and how to choose the appropriate answer. So I'm just skipping it right now. Yes, all of you are correct. The answer is D, musculocutaneous nerve. I will explain why it is called musculocutaneous nerve, what it will be innervating. Is it clear? So I'm just skipping and going. So once again, think about the pattern and the latest change, latest trend. Simple recall 60%. Yes, simple recall 60%. Before it used to be 90%. Problem solving, there are 3 types. Sometimes they can be mixed together. We have 30%. Before 2012, it was 10%. Image-based questions were negligible before 2012. Now we have direct or indirect 10%. You should know how to approach all these type of questions if you really want to pass. So now I'm going to show you everything easy, how to analyze the stem. One by one, I'll explain you. One very important thing, about 30% of the students tend to overlook the question. 30% of the students tend to overlook the question, which means they don't read the question properly. So what is the advice for you? Read each and every aspect of the question thoroughly. Because if you don't read the last qualifying part, yes, if you don't read this qualifying part, you will make a mistake. I already showed you. Many students were making mistakes without reading except. So read each and every aspect of the question thoroughly and carefully. Yes, and take care to read the direction. This is very important because direction is the part of STEM which is explained. Go towards the problem and know what is the question to choose the options. Next one, pay attention to qualifying keywords. This I already explained. Right. Okay, the last part is very important, which I'm going to show you right now. When the question is too bulky and complicated, what you can do is you break them into individual sentences. Your brain should be equipped to do this. I already explained to you about this. Once you start riding the motorbike, it is very difficult for you to hold the clutch, yes, push the gear and relieve this clutch. But once you start riding the motorbike or car, it becomes fluid. Even though it's a learned reflex, but it will start acting like a reflex which is instinctual, which is unlearned. Same story, once you keep working with more and more and more MCQs, your brain will be equipped to do this. Whatever I'm explaining now, automatically your brain will start to do this. So once again, read carefully, take care to read the direction, make sure you are paying attention to qualifying keywords. Last thing, if the question is too bulky, again keep it in mind, about 50% of the students, 50% of the students are scared of these bulky questions. And about 10 to 15% of the students are leaving such questions. They might be easy questions, but they are scared of this. So I want to show you how you are going to break it down. Now you can see, this is a case. Once you get such a case, you are going to break it down into individual sentence to understand what exactly is the direction. So it will be easy for you. There are certain sentences, how I'm breaking it. Now you can see, here it is looking scary. It is looking confusing. It is complicated. What you should do, your brain should be evolved. It should be equipped to break it down into individual sentences. What are these individual sentences? A 55-year-old chronic smoker is brought to the emergency with history of polyuria, polydipsia, nausea, altered sensorium. So next one, he had been diagnosed as having stage 2 squamous cell carcinoma of lung. And on examination, he was lethargic and confused. Next sentence, his ECG shows short QT interval. The last one you can see over here. So what is the suspected cause of this symptom complex? Now you can understand your brain should be able to differentiate what is written in these sentences. So what I highlighted in pink color are about the history of the patient. So technically he is 55 years old, he is a chronic smoker, and he already has stage 2 squamous cell carcinoma. What is marked by blue color? This is going to be symptoms and examination. And what is yellow color? This is instrumental diagnosis. Last one, the direction. So once you are reading a bulky, complicated question, automatically you will get confused. What your brain should be able to do, divide them into possible sentences and try to highlight in your brain what are the correlating things over here. What are the correlating things? Now you can see. The pink ones are correlating. Why? History. The blue ones are correlating. Again, what? Symptoms and examination. And the yellow one is going to be, yes, the instrumental diagnosis. How to come to a conclusion, I'll explain. Now it is easy for you. See, this looks scary. This looks confusing. This looks okay for you. Now you can sort out what do you want to do exactly next. Is it clear for you? Did you understand? You can write yes or no. You guys can write. Can I continue? Okay. Fine. Let's go to tricks or hacks to approach various type of MCQs. I'll do faster, one by one, how we are going to do this. Now let me go to negative stem question. How do we do this? I'll explain you. Normally, when you are advised not to do something, your brain will start to do that only. This is how your examiners are tricking you. If you remember in the school time or once you're staying alone in your house, your mom would be advising you, don't be scared, don't think about ghosts. When your mom is saying, don't think about ghosts, what do you start thinking? You think about ghosts. It's very simple. The same story over here. Once they are giving you, yes, a negative stem question, you always get confused because you start thinking opposite. So how to do this easy, I'll show you a special technique. So this is the same question. I'm going to explain you the question now. Okay? So what is the question? Fibrinoid necrosis may be observed in all of the following except. So once it is a negative stem question, you get confused, you might make a wrong option. So you tell your brain, first you remove the except. If you remove the except, the question will become positive stem question. Yes, it will become a positive stem question from a negative stem question. So now what is the question after you remove except? Fibrinoid necrosis may be observed in all of the following. Now you should remember there should be multiple answers correct. There are 3 answers correct. What are these 3 answers? So fibrinoid necrosis. What is fibrinoid necrosis? This is a special morphologic variant of necrosis where you will be finding fibrin-like proteinaceous material accumulating within the cell wall, within the wall of the blood vessel, not cell wall, within the wall of blood vessel or around the wall of this blood vessel. So once again, this is a special morphologic form of necrosis where there will be accumulation of fibrin-like eosinophilic proteinaceous material either within the wall of blood vessel or around the wall of blood vessel. What is the most common association? Malignant hypertension will be most common association, and immune vasculitis where there is going to be antigen antibody complex. For example, PAN, polyarthritis nodosa, and also rheumatic fever. Rheumatic fever is connected to antigen antibody complex. What is the characteristic feature in microscopy? Ashoff nodule. What do you find in center? Fibrinoid necrosis. So you converted the question into positive. Once you have positive question, you have 3 answers. Once you make these 3 answers correct and exclude them, what is going to be pending over here? 1 answer. This is diabetic glomerulosclerosis. So you understand how to approach the negative stem question, make it into positive. Once you make into positive, your brain will tend to choose 3 answers. You remove these 3 answers, the last one is going to be the correct one for except. Now you convert it into yes, negative form, you get this one. Diabetic glomerulosclerosis is not an example of fibrinoid necrosis. There is accumulation of plasma proteins in glomerulus because of leaky capillary by 2 mechanisms. So this is not fibrinoid necrosis. Did you understand? If you understood, you can write. Yes, if you understood, you can write. Yes, can I continue? Okay, we can go to the next one. What is next type of question? Okay, simple recall question. Keep it in mind, simple recall questions can be about 60%, and in some cases it can go up to 70% according to analytics. So here The answer will depend on the recall. I already told you the recall ability will depend on revision and some special recalling technique while you are prepared. For example, I advise you to use mnemonics. I advise you to use some special techniques. If you are a visual learner, once you are doing the exams, to recall the fact, while you study, what you should do, you should mark the special point with multiple markers. Usually we use 3 markers. What are these 3 markers? It is green, yellow, and orange marker. Green marker, yellow marker, and orange marker. Green means high yield and most commonly asked. Yellow marker, high yield, but confusing for you. Orange, high yield, but you are seeing for the first time, you will tend to forget. Once you have color coding, if you are a visual learner, once you study this, it will be recorded in your brain. This is how your brain works. Once you are doing the exam, you close your eye and you try to recall with the colors you used. This way will help you. This is one of the techniques. And if you are an auditory learner, you should understand, once you are approaching an MCQ, how do you learn? How do you revise? You recall things. You are reciting and you are shouting the answers. So once you are approaching the question, close your eyes. You cannot shout in the exam hall. So you are going to, yes, try to call them. You are going to articulate them, but you are not shouting. You are going to tell it by yourself. This is one of the other techniques. One of the very important technique is mnemonics. You use mnemonics to remember. For example, MOST, most is mnemonics of association of some HOMA body. So I'll show you one question how to remember. Muscles of rotator cuff except. Try to answer. Then I'll tell you what is the mnemonics. Try to answer. Answer. Yes, somebody asked that please share WhatsApp group. Yes, I'm going to share WhatsApp group by end. I'm going to share again the Telegram group what we are using. And also I'm going to provide you the access to our app. Keep it in mind, whatever I'm telling you, you can read it in our website. The whole message I am providing will be given in a written form in an article. I'm writing educational psychology articles. My website is completely free of cost. Yes, and you are going to use this and you are going to read this. After watching my lecture, if you have any doubt, you can read everything I explained in our website. I'm going to share that too. Okay, let's go to the answer. So answer should be what it is. Sorry, it's going to be latissimus dorsi. It is going to be latissimus dorsi. So answer should be D. Don't worry if you made a mistake. How to remember this one? Now you can see how to remember this one. So this is going to be your mnemonics. So what is rotator cuff? So you should know that our shoulder joint is highly mobile in our body. The most highly mobile joint in our body is shoulder joint. Or in anatomy, we call it glenohumeral joint. Because it is highly mobile, what is happening? There's no obstruction for the mobility. So you don't have any body structures or cartilaginous structures around to obstruct the mobility. So the structural support is lower, which means the most unstable joint in your body is going to be same. It is shoulder joint. That's why this is most commonly dislocated. So to give some kind of stability and support, 4 muscles around your shoulder joint will be forming a special cuff. We call it rotator cuff. So the tendons of these 4 muscles will be becoming a flat rotator cuff structure, and this flat structure is going to fuse with the shoulder joint capsule before attaching to the insertion point. So because they are coming from top, they are coming from behind, they are coming from anterior, from all these sides, they are going to fuse to the capsule. and they are going to hold the capsule in position. They give stability and structural support because we don't have any other structural support. So this is preventing you from dislocating the joint. But keep it in mind, there's no support inferiorly. There's no support inferiorly. Why? You have superior support. This is supraspinatus. You have posterior support. There are two muscles, infraspinatus and teres minor. You have anterior support. What is that? It is subscapularis. So superior, posterior, anterior support is there. No inferior support. This is the reason why most common type of dislocation will be inferiorly. It is easy to pull it down. Why? There is no structural support. So there are four muscles and their tendons are going to become flat and they are fusing with the capsule to become rotator cuff to give stability and support to this shoulder joint to prevent dislocation. What they are? Supraspinatus starting from scapula, infraspinatus starting from scapula, teres minor, this is not teres major, starting from scapula, and subscapularis starting from scapula. These three, supra, infra, and teres, they are going to go and attach to their appropriate facets of greater tubercle. And subscapularis will attach to minor tubercle. How to remember this? SITS, S-I-T-S, S-I-T-S. Keep it in mind once we are using this mnemonic. The T is small, not capital. All others are capital. S-I-T-S, small t. Why it is small t? Because it is teres minor. It is not teres major. So what is going to be the answer? Latissimus dorsi is not there. So whoever message it is teres major, it is not teres major, it is teres minor. How to remember? It is a simple question. It is a simple recall question. You cannot keep all the information in your brain and recall it. You need some special techniques. We are advising you to go through mnemonics. If you are a visual learner, do marking and you recall it. If you are an auditory learner, you try to close your eye and recall. Don't shout. Tell it to yourself. This all will help you. And also people who are kinesthetic, you change your posture. You try to sit straight and you try to change your posture. People who learn by kinesthetic type of learning, they try to move their hand, they try to move their necks. Such type of postures also might be helping you to recall. This is from psychology. So keep it in mind. If it is simple recall, you are going to foster some techniques to bring the memory back. Most important one is mnemonics. Did you understand? If you understand, you can say yes. So I'm going to go. So capital S, I, only small t. Why? It is minor. Did you understand, all of you? Yes. Let's go to the next one. Okay. I'm going to next one. Approach to conceptual one. Keep it in mind. I already told you about this case based. Yes, first thing what you want to do, it is very complex. It is too bulky. First thing what you are going to do, you are going to break it into sentences. Yes, you have first sentence, second, third, fourth. Yes, at last you are going to think about the options too. So this way I already told you, your brain should be wired to highlight whatever the related or the correlated content. So this is going to be about the history. This is about the symptoms, signs, and examinations together. And the last part is instrumental diagnosis. And then they are asking you the question. This is called as direction. Then you will look into all options. You're going to read all options. So this is how your brain is working. So how to approach, what are the tricks of approaching the conceptual question? There are three things to be done. What is the first thing? You are going to read and understand what is the definition or what is the problem here. So define the problem. This is number one. Define the problem. Second thing you are going to do is define the intermediate goal. Third thing what you are going to do is define the long-term goal. Once again, It is a complex question. Yes, anyone? You are writing something? Let me check. Yeah, I'm continuing. Yes, yes. So once you are getting a complex question, conceptual question, you are confused, they are bulky, divide them in appropriate sentences, and your brain should be equipped to work to highlight the correlated content. So once you do this, first thing what you are going to define the problem. Second thing, define the intermediate goal. Then long range goal. I'm going to ask question one by one. I'm going to explain you. I'm going to walk you through. I will ask question, then you can write the answer. So according to this question, patient is 55-year-old, so he's old enough. He is a chronic smoker. So this is a very high risk factor. He already developed stage 2 squamous cell carcinoma. So he has cancer. What are the symptoms? Polyuria, polydipsia, altered sensorium, lethargic and confused in the examination, which means he is becoming weak and confused. So something is suppressing his central nervous system. His central nervous system is being suppressed. And next is the very important catch point. Yes, it is going to be ECG. So let's go and define the problem. He has cancer, but his presentations are not connected to the cancer straight. Why? It is stage 2. He doesn't have metastasis. So the symptoms, what is here? Yes, or the presentation or the examination, what is presented here, they are not directly connected to the cancer. They are indirectly connected, so they are not directly connected to the invasion of the cancer, bulk of the cancer, or metastasis. Why? This is stage 2. So the symptoms are caused by cancer, but not by the direct effect or metastasis. How do we call this? We call this symptom complex as, how do you call this? How do we call this? You can write. Yes, you can start writing. The symptom complex in tumors, which is not related to the tumor mass or direct invasion or what is next? Metastasis. Such a symptom complex will be called as paraneoplastic syndrome. Yes, you are correct. One student wrote it. Is it clear? So defining the problem is the first role. What is the definition of problem over here? Defining the problem. This is paraneoplastic syndrome. What is this? Paraneoplastic syndrome. So paraneoplastic syndrome is definition of problem. What is the intermediate goal? You are checking that there's polyuria, polydipsia. Yes, he has nausea. So something is suppressing your nervous system. So the threshold of nervous system is increasing. It is suppressing. And ECG is showing short QT interval. So what is the intermediate goal? Define the intermediate goal. What is suppressing the central nervous system? What causes short QT interval? Can anyone say? Central nervous system suppression, polyuria, polydipsia, nausea, short QT interval in ECG. What causes this? Can anyone write? Can anyone write? What causes this? What is the definition of intermediate goal? No. ADH doesn't have any change in ECG. There's no change in QT interval. You have polyuria, you have polydipsia, you have nausea. Yes. One student wrote it. Yes. And short QT interval. All of them are connected to hypercalcemia. Yes, you are right. Hypercalcemia. So there is increased calcium level. Okay. So you already defined the problem. This is not exactly cancer. Cancer is doing something except for direct invasion. This is called what? Paraneoplastic syndrome. You defined the problem. Intermediate goal, the symptom complex and instrumental diagnosis is showing you something. What is this? Hypercalcemia. Now you are going to the long range goal. Define the long term goal. So what is the suspected cause? Yes. What is suspected to cause this symptom? Now you can compare A, B, C, D. All of them are hormones or hormone-like contents. So what will increase calcium is not ADH, it is not ACTH, it is not insulin-like peptide, but PET. What is this? Parathyroid hormone-related peptide. Parathyroid hormone-related peptide. What it will be doing? It will be working on the bone, it will be breaking down the bone, so calcium will be released. There will be resorption of calcium from kidney and it will throw phosphate outside. Yes, so resorption of calcium from bone, absorption of calcium from kidney, altogether calcium will be increasing to very high level. This is called malignant hypercalcemia. Keep it in mind, squamous cell carcinoma is most commonly associated with such kind of malignant hypercalcemia. Did you understand how to approach? If it is bulky, if it is confusing, break them into, you're going to break them into individual sentences. You highlight the related contents. What you are going to do, define the problem, then define the intermediate goal, then define the long-term goal. So here, problem is paraneoplastic syndrome, intermediate goal is hypercalcemia. So what will cause hypercalcemia? Exactly this one. So what is the answer? Answer is C. Yes, you are correct. Can we go to next question? You can write. Can we go to next question? Did you understand? Do you have any doubts? Okay, let's go. Now we can go to image-based questions. So there are various types of image-based questions. They can give you a gross photo. They can give you a photomicrograph, which means it can be histology, it can be histopathology, it can be microbiology, it can be hematology. Yes? They can give you a graph or process. So I'm going to explain you everything in detail, how to see this. Let me go to the next slide. Okay, this is the question. I'm going to explain you here. How to approach this question. So first of all, if you get an IBQ or image-based question, a gross photo, you are going to observe. How do you observe? Keep it in mind. This is going to be your point where you have to observe first. And you are going to observe what is around this. There's a saying in French, you tend to overlook things that are obvious. You don't see things what is near to you. So keep it in mind. First you observe, then you are going to think and recall the structures that should be over here. Then compare and contrast and come to a conclusion what is asked over here. Now you can understand they are showing a muscle over here. What is this muscle? Can you type? What is this muscle? Anyone can answer? What is this muscle? Yes? So one by one, biceps, biceps. Okay, what is brachii? Okay, biceps, biceps. How many people? Just write, no problem, nothing to worry, write. Any muscle. Don't worry, make mistakes and learn. More answers, no answers, that's it. Biceps, biceps. Biceps, okay. Okay, be ready. I'll try to answer this question. This is not biceps. I already told you. When you see this arrow, you tend to overlook what is around. The French saying is what? you tend to overlook whatever is around you. So I'll just show you this thing. I'll just show you this thing. I'll see how to erase this. I'll erase this. I'll erase this. I'll erase this. I'll erase this. So I'm going to show you something. Now you see here carefully. First you look exactly what is this arrow. After that you are going to see what is around. Now you can understand, you see exactly here, a muscle is cut over here. Can you see? A muscle is cut over here. Exactly over here. A muscle is cut over here. Can you see? And the muscle is cut over here too. Now you can understand the anterior compartment of the arm will contain how many muscles? Write down the answers. Anterior compartment. So now you should know we are talking about the anterior compartment of the arm. How many muscles will be there in the anterior compartment? Let's see. Anterior compartment of the arm. I'm talking about arm. Yeah. So let's come to a conclusion. Anterior compartment of the arm will be containing 3 muscles. How many layers are there? There are 2 layers. There is a superficial layer and deep layer. You see, this is the superficial layer, but they already cut this muscle. You understood? They cut this muscle. They cut this muscle, yes? So they cut this muscle. What is this muscle? So this muscle is biceps brachii. This is biceps brachii. You can see over here, there's a long head, there's a short head. Long head is coming from supraglenoid tubercle. This is coming from the coracoid process of scapula. Both of them will be forming one belly, and it is fusing here to become one tendon. This tendon is going to go to attach to radial tuberosity. Now you see they cut this muscle. If they cut and remove it, you find the deeper layer. What do you find? You have brachialis. This is brachialis muscle. And there's another one muscle. Can you see over here? This one is C. This is called coracobrachialis. It is starting from coracoid process and it is attached to the upper medial side of the body of humerus. Can you see here? So there are 3 muscles here. B, C. And the nerve which is going to innervate is coming from your brachial plexus. Yes. How do you call this nerve? Musculocutaneous nerve. How to remember the innervation? Musculocutaneous nerve will be called as BBC nerve. Why BBC nerve? What is the mnemonic? B is biceps, B is brachialis, B and the C is coracobrachialis. This is brachialis muscle which is marked by the arrow, and the tendon will be going here and it is attaching to the ulnar tuberosity. This is the primary flexor of the elbow. Brachialis is the primary flexor of elbow. Musculocutaneous nerve will be innervating B, C. That's why we call it musculocutaneous nerve. Most of the students make a mistake thinking that median nerve is innervating. The median nerve doesn't innervate any muscles in the arm, only in the forearm and in the hand. Did you understand this? So you observe, you recall what exactly is this structure, you analyze what is this location. First of all, what is this? This is called brachium, or we call it arm. Which compartment? Anterior compartment. Where we are standing in the deeper layer. Why? Because the superficial layer is cut. So you should go by recalling the structure. Then compare and contrast. If this is cut, what is this muscle? This is going to be brachialis. If brachialis, what nerve will be innervating? B, C, musculocutaneous. Did you understand? You can write if you understand. I can go to the next question. Can I go to the next question? Okay. Did you understand the question? Yes? You understand how to approach this? Yes? Good. Let me go to the next one. Okay. This is my favorite slide. It's a very beautiful slide. So once you get a photomicrograph, it is more complex. You should know that it's very difficult to understand things, because when I am teaching morphology, either histopathology or histology, when I ask students, what do you see through the microscope? They say, sir, we are seeing pink dots and blue dots. Of course, if you want to understand what exactly is this, you should train your eyes. You should keep looking at more images. Keep it in mind. More you watch, more you understand. So that's why my professor used to say, who was my supervisor, pathologist's eyes are like eagle. It will pick up only whatever is necessary. It will pick up only what is diseased. You should develop the same instinct. So the problem with analyzing such photomicrograph, what is going to be the analysis? I'll show you over here. First of all, you will observe, but you have a special technique of observing. What is this special technique? The simple technique is called 5-point technique, and more complex technique is called 9-point technique or Z technique. 9-point technique or Z technique will be more accurate than 5-point. But once you don't have enough time, we have only 40 seconds to approach one question. I recommend you, FMG aspirants, to go for 5-point simplified technique. What else you should pay attention to? Read the question properly to understand what stain is used. Because H&E stain will be staining calcium in different color than the special staining of calcium. Or H&E will be staining, for example, fat as a vacuole, because once you are processing, it will be removed. Once you are using oil red, fat will be stained as red color. In osmic acid, fat will be stained as brown color. So you should pay special attention to stain. Type of microscopy. Why type of microscopy? You should know it's simple. Light microscopy, electron, dark field, or it is immunofluorescent microscopy. So you should know what you are looking at. Last thing, you should think about magnification tool. After that, it is simple. You observe through 5 points, you recall what you are watching at, and you compare and contrast, and you come to a conclusion. I'll show you. So this is the technique I want you to go through. Yes, this is the technique. 5-point technique. So you're going to 5 corners. So you look at first corner, not 1 point, so you are going to look around. Yes, you are going to look at the other corner. You are going to look at the lower corner. You are going to look at the other corner, and you are going to look at the middle. So 5 points technique means you are looking into 4 corners and center. You are going to look not into 1 point, but you are going to also see what is around. For example, if you see only 1 and 3, you will tend to miss something very important in 2 and 4. Yes? If you look into 1 and 3, 2 and 4, you will tend to miss something which is located at the center. So the easiest way what you are going to do is going to be this way. Yes? You look into this corner. You can go this way. Yes? You look into this corner. You look into this corner. You look into this corner, and you are looking into the center. Either you can come 1, 2, 3, 4, 5. Or you can come 1, 2, 3, 3, 4, and 5. 5 is there. Did you understand what I'm saying? You can write yes if you understand. You can write yes, yes. Did you understand? All of you? Yes? Okay. So I want you to follow which technique, because you have hardly 40 seconds. You are going to follow 5 techniques. Guys, mute. Guys, please mute. Guys, can you please mute?
காலையில என்ன சொன்னா நான் ஞாபகப்படுத்துறேன்.
Yes, can you please mute? Okay, let's go now. Okay, let's go to the next section. Oh, like try to finish. So if you want to really learn how to see the slide, we use 9 technique or we use Z technique. So 1, 2, 3, yes, 4, 5, 6, 7, 8. You are looking into all 9 corners. Z technique is more or less same. I'll show you what is Z technique. Like this. This is Z technique. More or less 9 points technique and Z technique is same. But for you, I advise in FMG you have hardly 40 seconds. So you use 5-point techniques or 5 corner techniques. Is it clear? So now you can see over here. Now I want you to look into this slide and understand. It's one of the most beautiful slides I have. So can you answer the following question? What is the most important risk factor of hepatic cancer or hepatocellular carcinoma? Can you answer? What is the most important and common risk factor of hepatocellular carcinoma? Can anyone write? Not just alcohol. Alcohol should do something. What is it? Yes, it is cirrhosis. So it is cirrhosis, of course. Now you see how beautiful is this slide. You can see, of course, because I'm a pathologist and I work with anatomy, for me, slides are beautiful. You can see this side. This is the cirrhotic nodule. This is a cirrhotic nodule. So what is the meaning of cirrhosis? There is irreversible fibrosis with pseudolobules or nodules formation will be called as cirrhosis. It should be irreversible fibrosis. There will be fibrotic strand. You can see here, this is the fibrotic strand or septa. This fibrotic strand is coming from where dead necrotic tissue will be replaced by fibrotic strands. They are irreversible. In between this fibrotic strand, what is happening? The hepatocytes that are left over will be proliferating. These are called as cirrhotic nodule or pseudolobule. What you can find over here, you find hepatocytes. Now you can see the cytoplasm is pinkish in color. Nuclei are prominent. Why? Because they are proliferating. Sometimes you might see 2 nuclei. It's possible to see more than 1 nuclei in regenerative nodules. Why? This is a regenerative nodule. I'll show you 2 nuclei. You can see here. This is the point where you find 2 nuclei. It's not pathologic. Once you have regeneration in liver, you tend to find 2 nuclei, even 3 nuclei. It is not pathology. Why? You can see over here, yes, the cytoplasm is pinkish. Cells look normal, but they look a little bit bigger here. There is no lobular architecture. Why? Because there is massive necrosis of the liver, and this is the regenerative nodule between fibrous connective tissue strands here. You can see this is fibrous connective tissue strand. Fibrous connective tissue strand. And in this fibrous connective tissue strand, you are finding abundance of lymphocytes. These small dots are lymphocytes. Is it clear? I think this cirrhosis should be from from viral hepatitis, because usually in case of viral hepatitis, nodules are bigger and strands are thicker, and these strands will be having a lot of lymphocytes compared to alcoholic hepatitis, which is progressing into cirrhosis. In alcoholic, usually the strands are thinner and lymphocytes are very less. I think this is due to hepatotrophic virus. Yes, you have cirrhosis due to virus. So what is the grave mistake you might do here? If you look into only this corner, you don't look into this corner, you are going to miss out something very important. What is happening here? Can anyone tell what is this? Can anyone write what is this? I'm showing this side. Yes, what is this? Can anyone write? Okay, there was a pseudolobule, I agree, but what is happening inside pseudolobule? There is no fibrosis inside. Fibrosis means fibrotic tissue will be pink in color. Fibrosis is here, I'll show you. Yes. Fibrosis means you have a lot of collagen, which means technically it's where you can see here. Let me show you here. You can see here, this is fibrosis. This part is fibrosis. This is fibrosis. You see, this part is fibrosis. This is fibrosis. This part is fibrosis. I'm showing in yellow color, this is fibrosis. So, what is this? Don't worry, make mistake. What is this? I'll show you. Where do you find necrosis? I already told you, if you are a pathologist, your eyes will be trained to look into the pathology. This is one of the beautiful slides I have in my collections. That's why I wanted to show you. I already told you what is the most important and common risk factor of hepatocellular carcinoma is cirrhosis. You see, this is cirrhosis. This cirrhotic nodule already became cancer. This is cancer. This is hepatocellular carcinoma. I can show you one by one how to differentiate this cell from this cell. I'll show you once again. You see this cell, yes, or this cell from these cells. From these cells. Yes, from exactly, yes, these cells. One thing, keep it in mind, compare the cytoplasm. See the color? What is the color? This is more bluish in color. This is not regeneration. This is regeneration. Guys, regeneration is in 1 and 3. This is not regeneration. Regenerative nodule already became cancer. Regenerative nodule area has been invaded by cancer. This side is cancer. This is cancer. This side is regenerative nodule. This is cancer. I already told you, you have cirrhosis, especially post-necrotic cirrhosis, you tend to develop cancer very fast. Hepatitis B and hepatitis C. Now you can see, yes, can you see the cytoplasm? Guys, can you please mute? The cytoplasm is bluish in color. You already know in case of cancer, cancer cells are producing a lot of protein, which means a lot of RNA in cytoplasm. Cytoplasm become more basophilic. You see, this is more or less pink. This is more or less bluish in color. Cells are showing pleomorphism, different shapes, different sizes. Very prominent nuclei. Can you see the nuclei which is very, very prominent? you compare this nuclei, which is small, compared to the size of cell. Cell is big, nucleus is small compared to the cell. But here, cell is not so big, but nucleus is covering more than half of the cell. Yes, this is called nuclear cytoplasmic asynchrony. Sometimes cell will be big. It is called giant cell. Can you see this? This is giant cell. Big nucleus, prominent nucleoli. Sometimes you find spindle cell. You see, this is a spindle cell. Sometimes multinucleated cells you can see over here. And these tumor cells are accumulating like sinusoids or trabecula. Can you see the gap between these tumor cells sheets? There are gaps. So there are multiple forms of histology of hepatocellular carcinoma. This special form is called sinusoidal or trabecular form. This is cancer. Why I want to tell you this is a beautiful slide, because you see one side you have regenerative nodule, beautiful regenerative nodule. You have a very prominent fibrous connective tissue, septa. All these things are like, strands. And in the opposite side, already the pseudolobule is invaded by cancer. This is hepatocellular carcinoma. Now you see, if you checked only corner 1 and 3, what will you miss? You will miss the cancer. If you look only into 2 and 4, you will miss the cirrhotic pseudolobule, regenerative nodule. If you don't check this 5, you will miss this fibrous strand. That's why, what is the best way of doing? 5 points for you. Easy, fast, and very effective. 5 points. 1, 2, 3, 4, 5. Did you understand? Guys, you can write. Did you understand? Can I go to the last one? Okay. Okay, the last one now is the last type of image-based question. Yes, they can ask you a question with a graph or a process. How to approach this? First of all, you are going to observe everything. Then you are going to sense the detail of the graph, what they are talking about. Then you are going to use your brain to analyze the dynamics and fit it into your physiology or the process to understand what they are talking about. I'll give you an example. So there is a graph here. First you observe what is there in the graph. There are 2 graphs here. And you are going to see in one axis, they are showing the time in hours. Yes, 9 o'clock, 10 o'clock, 11 o'clock, 12 o'clock, 1 o'clock. So night and late night, then early morning. So in one axis, hours. In the other axis, they are showing you sugar level. This is blood glucose. Blood glucose is measured in milligram per deciliter. Is it clear? So they are talking about time versus the blood glucose level. They are checking how much is the blood glucose level in the night and in the early morning. So now you can understand, you compare this graph. Let's talk about this graph B. What is this graph B? So now you can assess the dynamics of this graph. Yes, you can assess the dynamics of this graph. So the sugar level was 500, which is quite higher. So technically, before going to sleep, his sugar level is very high. So he should be a diabetic patient. You should understand, analyze. And once he is going to sleep, you can see the sugar level is dipping very low. Normally, fasting glucose is between 70 to 100 milligram per deciliter. But now this is going below 70. So he is developing hypoglycemia. Hypoglycemia. What will happen once you develop hypoglycemia? Your body is going to be alarmed that you are depriving of glucose. So you can die. When there is no glucose, Your brain can't work. I already explained you. It needs glucose for oxidation for ATP. It cannot sustain without glucose. So once there's no glucose, once there's hypoglycemia, automatically your body will be activating hormones called contra-insulin hormones. So all these contra-insulin hormones will try to mobilize your carbohydrates to increase the glucose. So now you can see automatically, once it is going to be late night and early morning, the glucose is again peaking to 700. But it is not controlled. Why? Because he is a diabetic. So hypoglycemia is causing hyperglycemic peak. So this condition is called as post hypoglycemic hyperglycemia. So you see, first you see the graph, you observe the graph, you send the detail, then you analyze the dynamics and you try to fit it to your physiology or biochemistry. Now if they ask any question, you can answer this. So what is the most common cause of this graph B? Can anyone tell? Most common cause of graph B. Okay, you can write. Did you study pharmacology well? Did you study pharmacology well? You can write, no problem. Do you know what is this phenomenon called? This is called Somogui phenomenon. Any of you heard about this? You can write yes or no, no problem. You are learning something new now in pharmacology. Somogui phenomenon. Yes, Somogui effect, Somogui phenomenon. This is a complication of insulin therapy. If you are using wrong dose of insulin, you can develop this graph. I'll show you right now how it works. Patient has 500 milligram per deciliter. If you give high dose of insulin, this insulin is not appropriate. So high dose of insulin will make this patient to become hypoglycemic. So by mistake, you gave extra dose of insulin. So this hypoglycemia will activate your body to bring contra-insulin hormones. Like what? Glucagon, growth hormone, yes, glucocorticosteroids, and also two more hormones. What they are? What are contra-insulin hormones? Can anyone write? Anyone write? Contra-insulin hormones. You can write. There are 5 of them. What they are? Contra-insulin. Yes, somatostatin, glucagon, growth hormone, glucocorticosteroids, and the last one is what? 5th one? Yes, this is glucocorticosteroid. 1, 2, 3, 4. What is the 5th one? Epinephrine. Yes, you are correct. Good. So the last one is epinephrine. All of them will increase to mobilize the carbohydrate to increase glucose. So first you develop hypoglycemia because of the because of the wrong dose. It develops hypoglycemia, activation of contra-insulin hormones, develops hyperglycemia. How do we call it? Post-hypoglycemic hyperglycemia. This is called chronic Somogui phenomenon, or just call it Somogui effect. It is caused by wrong dose of insulin. How to treat this? Very simple. Calculate the dose, give the appropriate dose, you can prevent this. That's it. Simple. This is how you see the graph. Observe, sense, analyze the dynamic. Is it clear? Okay. Last simple part, how to choose the answers. So you should know that several of the answers may look correct, but only one is the appropriate choice. So you are going to choose one correct one, and you are going to evade, you are going to escape from the distractors. So what you should remember from here, already I explained you. You should read the question first, not the option. Some students, about 10% of the students make this mistake. they read the options and there are a lot of distractors and they make mistakes. Read the question, then guys, can you please? Okay, what is next? Understand the emphasis of question. So it is very simple for you. Read the question. After that, you close your eyes and you visualize what they are asking and what might be the answer before looking into the answer. This is the second thing. Before looking into the answer, you do one thing. You take a deep breath, relax for a second, or like technically, you can do it for a fraction of a second. And while inhaling, you think what you are thinking about. So first thing, read the question, not the option. After reading, you close your eyes and you visualize. After that, what you are going to do, you are going to take a deep breath for a fraction of a second and you are relaxed and you exhale. Once you are exhaling, you are going to look into the options. Keep it in mind, read all the choices. Don't jump into over conclusions. I already told you, examiners try to trick you by putting first and second choices as wrong answers. Is it clear? Okay, what is next? You can see optimal selection will be depending on the skills of blocking the distractors. So you should emphasize the question, and once you see the option which is correct, you should make sure the distractions are gone, but the direction and the answer is matching. Once you are going for all of the above or none of the above option, keep it in mind, in the options you have more than one or more than two correct answers or incorrect answers. You already know this. If all of the above means technically 3 should be correct. So you should put all of the above. None of the above means all 3 should be wrong. So more than 1 or more than 2 technically answers should be either correct or wrong. So it's very simple to understand. Read carefully, read the question, don't look into the option. After reading, close your eye and try to visualize what might be the answer. Take a deep breath for a fraction of a second, relax. If you don't relax, more anxiety, your brain won't work. Once you are exhaling, you look into the answers. Make sure you read all the options. Once you are choosing one option, you make sure the direction and option are matching. If you are going for all the above or none of the above, make sure more than 2 options are already correct or not correct. So these are the techniques what you have to follow once you are approaching the MCQs. Okay, in the next webinar, what I'm going to show you, how to change the choices or options. Sometimes you make the answer A, but you think that, okay, something is wrong. I should change it to B. So what are the factors which is determining this change? When you should change, when you shouldn't change. When you don't know the questions at all, you are blank completely. What is technically called as intelligent guess? Why do we go blank completely in the exam? What is the neurological basis of this? Very important thing, time management. Tackling various type of question, how much time you will give, pacing of different difficulties, and how to use the mark option and review option in MBE template. The last thing, don'ts and do's while approaching the MCQ. Don'ts and do's, or do's and don'ts while you approach the MCQ. Is it clear? Okay, fine. I'm finishing now. So very important thing I want to emphasize here. I gave you a lot of technical things. I know that many institutes don't teach this. No apps will teach you. No books will teach you. I know this. Because I'm getting at least 10 messages per day. 10 messages I get, sir, I bought XYZ app. I bought the best app in India. Come again. Okay, one question. I'll explain you, sir. Forget to share the WhatsApp. Okay. If 2 correct and 2 wrong. Okay, I'm going to explain this part. Keep it in mind. If 2 correct and 2 wrong, which means that if you are already sure, there's an option of all of the above and none of the above. If you are for sure to go for this all of the above or none of the above, thoroughly check remaining 3 options. More than 2 will be either correct or more than 2 will be either wrong. But keep it in mind, you might be confused and you are making a mistake and you are thinking 2 are correct, 2 are wrong. It is not possible, because keep it in mind, I don't know who is this student, read me notes. You can message me personally, I can explain you what exactly happens once you are trying to reason. Because you should know that you should not be confused. There's only one option correct. If 2 are looking correct, which means that you are making a mistake. And rarely, very rarely, 1 or 2 questions might be with mistake with 2 answers. I agree. In MCI, before releasing the result, they are going to check all these MCQs and they will just release a notice saying that question 150 and question 100 had mistake 2 answers, so we are giving grace marks. It rarely happens. I'm not saying it will never happen. So this student who is read me note, you can contact me, I'll explain you what might be your confusion. We can talk about this. Okay, let me finish this part. I'm going to give you the WhatsApp link. I'm going to give you the WeChat link. I'm going to give also our website. In website, you can read everything I explained to you. Once again, I'll tell you, no institutes are teaching how to approach MCQs. This is the main mistake of the institutes. Students don't know how to approach the MCQs. With knowledge, if you don't know how to approach the MCQs, you will flunk. No app is explaining. Most of the people who call me, about 10 people who call me, they say, sir, I bought XYZ app, but I don't know how to use it. There's no use. So once you are buying our app, you can go to talentnet.com. You can find various apps. There are like full package. There's grand mock, there's subject mock, there's module mock, too many apps. We are giving the least price in the market. Our complete app with 240 questions, study materials and video lectures of last minute revision is only for 4,000. Nobody is giving. We are giving the least one. Once you are subscribing and buying our app, you can contact us 24/7. We will guide you to study. I don't give just that. I teach you how to approach the MCQs. Okay, next one. We have a special class. I already explained you. This is called Smart Formula class. We are targeting for FMGE in 60 days. We are targeting FMGE August and September. We are doing a special analytics. We analyze the students. We analyze their strengths and weaknesses. We teach them exactly how to approach the MCQs, how to approach the exam, how to approach their own problem. We teach exactly what is needed. We are targeting 240 questions and we make sure that they score 190 marks. Now we are coming up with a new package. If you don't want to choose all the subjects, you can choose one subject. So one subject is 3,000 INR. But if you want to go for discount, you can contact us. You can use a coupon. Today's coupon is Dr. Harry 2020. We will give you 500 INR discount. If you come in a group, I will give you 500 INR discount. We are giving a lot of discount. You can avail exactly one subject for 2,000 rupees if you have discount. So please look into our website, or you can call us. We can counsel you, we can help you, and 3,000 rupees for one subject is nothing. And once you avail the discount, you can get it for 2,000. 2,000 is nothing. We are the cheapest one. Nobody is giving you. And all these features are provided to you. All these features. We give counseling. We check your progress. We are giving minute-to-minute counseling to you, 24/7 doubt clear. We teach you how to approach the exam. Okay, this is for the students. So we are maintaining a Telegram group called FMG Smart Formula. Here we are providing daily MCQs. MCQ discussions will be there. High-yield study materials in PDF will be given. And also short videos in hot topics. Please join our Telegram group. If you don't have Telegram, I'll provide you WeChat or WhatsApp group you can join too. So students, once again, I am here to help you for free. I agree in this point because most of the institutes are not teaching you exactly what to do. So I already explained my students, I'm teaching my students, they are doing really great. They are scoring 200 plus marks. but I don't want to keep it secret, so I'm teaching also anyone else. If you are interested, you contact us, we will be helping you. And thank you for joining. If you have any questions, you can contact this hotline number, or you can contact in WhatsApp, WeChat, and Telegram. You can take a screenshot. After completing this webinar, I'm going to cut it short, edit it. I'm going to upload in YouTube. In YouTube, you can find the link for WhatsApp, WeChat, Telegram, and also the link for the website. In the website, you can go and read whatever I'm explaining. It is my article. I have the references. I have the copyrights. So this is for you. I'm making it free. Utilize this thing. And please write in the comments if you liked it, if it is useful. Please write, because for teachers like us, enthusiasm is very important. If you support us, if you push us, if you engage with the webinars well, we will provide you more. We are there to help you. And best of luck. We are ready to help you always to crack this FMGE with the least effort. Please write your comments. Please write your feedback, what exactly you want, and we can help you. Not one, two. I guess that more people should write. Yes, Dr. Chandrasekhar. If you have any question, you can contact me. What doubt, sir? Dr. Chandrasekhar can write, yes. You can give the feedback if it is good. I know that I am taking much more time. I'm a professor at university level, and I usually don't, skip things and go superficial. I always explain things in detail. And when I'm giving you a free webinar, it should be useful to you. That's why I'm giving you all the contents and I'm teaching you everything. And whoever joined today should utilize this, and it should help you to approach the MCQs. If you follow my techniques, really go and implement whatever I explained to you. Try to do the MCQs as I explained you, and of course, you're going to get very high scores. Dr. Chandrasekhar, once we see, okay. You should always eliminate other option. This is one of the very important mistake. Yes. Don't pick directly. Read all the options. Dr. Chandrasekhar, read all the options. If you think answer A is correct, you should reason in your brain why answer B, C, D are wrong. If answer A is correct according to you, reason in your brain why B, C, D are wrong. Once your brain says it is correct, the three are wrong, then you choose answer A. Don't just pick up answer A because you are not reading the others. Read all the options, analyze, and after that, yes, after that you are going to reason. This is the work of your prefrontal cortex. Yes. I'll share the WhatsApp group. I'll share it. Just hold on, I'll get the WhatsApp group. Yeah, tell me, what is the next doubt? Dr. Chandrasekhar Verma, yes. What is the next doubt? Yeah, sir. About changing the option, I'm going to explain in the next webinar. It is a very complicated question because this is connected to educational psychology. I will explain you psychology when your mind thinks that you have to change the option. When you can change, why you should change, why shouldn't you change, all the thing I'm going to explain in the next webinar. I'm going to put next webinar by Friday. I'll explain everything, yes. Mnemonics, they are available in our app. I cannot give all the mnemonics because it takes quite a lot of time. And we are providing the app. If you want, you can buy the app. I'm not pushing you to buy as a businessman, but we can't give everything free because this is connected. This is bound to some kind of finance too. So I'm providing everything in our app. So I won't be able to give everything just like that as a PDF. Okay, from honor play to everyone. Same to same. First that I choose option 70 times correct, but choose. Okay, fine, sir. Regarding changing the option, regarding the intelligent educated guess, why do we go blank in the exam? How to manage the time? This is next webinar. I'm going to explain you everything in detail. So don't worry. By Friday, I'll explain you. Right now, you read the article in my website. I'm going to upload this in the YouTube. You watch my lecture once again, read my article, apply the knowledge, whatever I gave you, and you can understand how much you are like scoring. If you are scoring really 40, 50 marks, now you can score 75 marks for sure. Okay, if you have other question, how to study which subject first and all, this is completely out of this seminar. This question is connected to Davinci analytics. I already explained about this. So, Dr. HP, your question is, sir, how to study which subject first? This is the topic of first and second seminar. You can watch in YouTube. If you have doubt, you contact me. I will explain you. So students, once again, if you are planning to go for individual subject, if you want to buy, please contact me or you can contact Shiva. Take your discount. Today's coupon is Dr. Harry 2020. You get 500. You can choose any subject you want. And please look into our app. This is the cheapest option, but the best option because we are giving you guidance and counseling that nobody gives. Okay, sure. It's simple. Dr. Harry 2020. Dr. Harry 2020. That's it. This is the coupon. Okay, this is the coupon, Dr. Harry 2020. You have any doubt, feel free to call us, contact us, we are there to help you. You should know that, this is educational psychology. Once you mix with the knowledge, you pass. Simple. Thank you so much for joining. Thank you for your feedback. I'm going to put this in the YouTube. Please go and write your comments in YouTube also. More comments we get, more likes we get, we will provide you more. Thank you so much. Goodbye.